So from the Burwood-Cisco forum that we participated in today, I would say that the biggest issue that came up today really was management of opt-in versus opt-out in terms of patients. To the extent that we do opt-in as opposed to opt-out, we'll have some reduction in our ability to attract participants, both patients and providers. To the extent that we manage opt-in too tightly, we will make it much harder for people to choose to do that. So for example, as you know from the table that we had our discussion, on the relatively easy end, pretty much every entity out there that treats patients has a consent that the patient signed, which includes multiple clauses, including various HIPAA clauses. If it's possible to do opt-in within the construct of that consent, then it will not be as challenging as if we do it in some of the more challenging manners. So for example, if in fact it has to be a separate consent, distinct from that more general consent, and if in fact some staff person has to actually go through that form with the individual, then that's going to take additional staff time and add additional cost in, as I said, a healthcare system that already has financial challenges. If they go to the most extreme method of opt-in, where you actually have to have a clinical provider walk through the pros and cons of participating in health information exchange, then not only are you adding a labor expense, but you're adding the most expensive labor expense that you possibly can. And in our system as it exists today, I think that's going to be a very challenging hurdle to cross.